Hey everybody, and welcome to our show, Your Hometown Medical Minute. I'm your host, Hal Brock. With me, as always, behind the cameras, our IT Director, Mr. Ed Harrison.
Hey everybody, how's it going today?
Ed, we've got a great show lined up for everybody today. CEO of the Southern Plains Medical Group, Mr. Len Lacefield. He's our guest today. Len's been the CEO of the Southern Plains Medical Group for a little over 5 years. He's led SPMG to a growth that now consists of more than 18 medical specialties, has also more than 35 physicians and providers, which has led to more than 600% increase in monthly new patient visits. Today, we're going to talk a little bit about that growth, the expansion down into the Pauls Valley service market, and the restoration of the healthcare that was lost a little over 2 years ago when the hospital abruptly shut down. As well, we're going to talk about the latest venture for the Southern Plains Medical Group, a skin cancer clinic up in Edmond, the skin cancer specialist of Oklahoma, seeking to tackle the leading form of cancer in the United States and worldwide, skin cancer. We're also going to talk about our new annual wellness program for the Medicare population, a very important service, Ed, that kind of establishes a baseline for healthcare needs that might happen over the course of a year. Very important service for our Medicare population. And lastly, Ed, we're going to talk about, well, what everybody's talking about these days, COVID-19 or the coronavirus. What did SPMG do in response, how they reacted to it, and what information and services are available right here at the Southern Plains Medical Group clinics in Chickasha, Anadarko, and Pauls Valley that are vital during this long-standing battle with the coronavirus. And we're going to talk about all of this here right after this brief message, so stick around. All right, I'd like to welcome Southern Plains Medical Group CEO, Mr. Len Lacefield. Len, thanks so much for taking some time to come out and talk to me.
Thanks for having me, Hal. It's long overdue to try to get caught up a little bit and share what we're doing here.
Right, well, we've been a little busy over the last few months. And
a little busy.
Right. So, here at Southern Plains, we've experienced quite a lot of growth over the last 4 years and kind of restoring this big ship into what it used to be and then kind of better. Right, and I think that's every goal of every business. So I wanted to talk to you a little bit about that growth and kind of, if you could, share with everybody what Southern Plains Medical Center has now evolved to in Southern Plains Medical Group.
Wow, that's a big statement, Hal.
Yeah.
The goal here was to restore the integrity of the history.
Yeah.
And 105 years last month.
Right.
That's phenomenal, and I think that's a charge or an obligation that all of us have from leadership, down, to make sure that what we do honors the history. And although medicine's different, the modalities are different, the execution is different, and reimbursement's different, and all the things involved in medicine are different, still the core remains the same. One of the challenges that I think any healthcare company has or institution is patient focused.
Right.
And I'm really proud of the culture that we continue to drive into our team now into 3 counties, is that the patient is first. It's a challenge.
Yeah.
It's a challenge, but patients first. Our goal and philosophy is we're either providing direct care to the patients or we're supporting the person who is providing the direct care, or we're supporting the person that's supporting the person.
Right,
So you and I, and so although we do our daily job and we plan and we strategically do things and we do media and we do resource development, the thing that has to stay in the forefront of our mind is patient care. And that drives the first thing that you talked about is how we're evolving. I think we're re-evolving. I think Southern Plains Medical Center, Southern Plains Clinic, Chickasha Clinic, all the historical names, the hospital downtown, I think it clearly had that one thing in mind. You know, historically, healthcare was just the patient. And then it turned in the 80s into the business of healthcare. And now we get lost in the documentation and the requirements from Medicare and these different things. So much.
It got so confusing.
So much. What that did though was provide opportunity. Much like COVID, you know, where there is crisis, there's always opportunity. And I'm really grateful for the fact that we can be forward-thinking and anticipatory as a company to do these things. And so yeah, our expansion's been actually a pinnacle during the first 6 months of this year. We've done some really good things.
Yeah, we really have. And you talk about the expansion, and especially over this last 6 months, and you know, I definitely feel it because we've been driving all over the place. Can you tell us a little bit about the expansion and what's been going on lately?
Absolutely. You know, we've worked several years to foundationally secure our market share and deliver the services in our own backyard, so to speak. Our Anadarko market, our surgery there, our Chickasha market, our services here, the recruitment of specialists, additional providers, increased our staff, the quality of our staff, but then more specifically in the last 18 months, you know, we have gone to Pauls Valley.
Yes.
We've worked diligently at Pauls Valley. We met with the state on October 25th last year, and I'm really excited to say that it looks like October of this year, this summer, late summer, early fall, we'll be reopening under the branding of Southern Plains Medical Center of Garvin County. We are looking at a Jerry Psych unit there. We're looking at a foundationally life-changing diabetes relief program. We'll have physical therapy, we'll have surgery. We've got our emergency department there. MSA, we'll host a regional metabolic lab, which is incredible. So that's the initiative there. We've just hired Dr. John Moore, a second-generation Pauls Valley legend, to work with Dr. Jones and our team there. We continue to sustain our urgent care since January 1st outside through the hospital ED department. And now I'm happy to say this past Wednesday, in light of COVID, we've opened up the Skin Cancer Specialist of Oklahoma in Edmond, Oklahoma, right on the north end of the OU campus. So we continue to move forward in our core business, focusing on different things, on obligations through our Access Care of Oklahoma, which is our Medicare, and our population management through the recent establishment of our annual wellness visit program, which is providing extensive, just over-the-top care, right back to our core value. So we're really grateful for the opportunity. We're really excited to see how the year ends there. 2021 will be a significant move forward for Garvin County and all the surrounding counties and the people of those areas that we're just humbled and blessed to be able to serve.
Now you mentioned the skin cancer clinic in Edmond. Now skin cancer is the most common form of cancer in the United States and worldwide. So this is huge to me, and it's right there in the center of Oklahoma, pretty much. What are you guys going to be doing with that clinic up there?
Wow, Hal, this is one of those opportunities that you think about, but there's absolutely no way you can do it until something happens. 2 years ago, Dr. Ray Corneliuson called myself and one of my senior partners and said he needed a place to practice. Well, you have to understand, Dr. Corneliuson's been a national figure in dermatology for years. He ran OU's department. He had his own facility in Eastern Oklahoma County for Midwest City for decades. And everybody knows Dr. Corneliuson to be an expert in dermatology and treatment thereof. So the great news is he came down here. We formed our dermatology department here. He still had a core of a significant number of referral sources throughout the state, much to include Oklahoma City. So as an Oklahoma City resident, we had a cancer center in Edmond that was, we were not involved in the management of or propagation of, but still partnerships with. That resolved in simply just they had other clinics that were operating, and we then had our own 6,000 square foot facility already established, and the market worked well. So Dr. Corneliuson said, listen, why don't I stage that for several days a week and grow that? So that was the first impetus of it. So now we opened with him being available for our marketplace to expand to Oklahoma City over 1 million people, right? Sure, yeah. And so they don't have to drive the 30 minutes to Chickasha. They can, but they don't have to. They can see Dr. Corneliuson in Oklahoma City. But then how do you take a specialty that you can't get outside of metro areas and take it through the western part of the state or beyond? And we have a really exciting app that is a dermatology app that we're going to provide physicians throughout Oklahoma, focusing on the western half of Oklahoma first, whereby this primary care doctor, who will never be able to get that patient to drive to Oklahoma City for a cancer or wait 6 weeks, can actually have an office visit with that patient with the app and beyond telehealth, but interact with Dr. Corneliuson through definition of a presentation, through photographs and things, and they can collaborate as physicians and professionals and specialists to treat that patient. Now we're going to go beyond that in treating with specific cancer treatment modalities in that facility as we move towards the fall. But we're going to literally bring dermatology from that office and this office through the entire western half of Oklahoma, where they would never have gotten care. And as you know, the western half is a significant portion of that 10,000 new cases of skin cancer in Oklahoma every year, because everybody's outside. Everybody's doing their thing outside.
So can you tell me a little bit about this annual wellness program?
Absolutely. Medicare began a population health management to reduce long-term costs to the Medicare population. In turn, what that did was set up guidelines and functional diagnoses and diagnostic testing on an annual basis. It starts with when you become a Medicare recipient, you get an annual, you get a new Welcome to Medicare visit. The Welcome to Medicare visit has certain benchmarks and criteria that you want to cover. This is outside of the traditional chronic care or urgent care that we would provide through all of our different specialists and providers. So when you do that, you establish the idea and the mode where you might catch something earlier. So each year, Medicare pays for an annual wellness visit, at which time you're able to identify things the patient might need. You talked about dimension. We have a DIM score where we have patients draw a clock to determine the days, the times. We talk about sensation, we talk about gating for stability, we talk about their home life, we talk about their needs. We do chest x-rays, EKGs, we do referrals for diabetic eye exam, foot exams, colonoscopies. We're able to, our team that's building now is actually, that impact could save a life, or at least get that data to their provider, to their doctor for the next visit to analyze this, where it's such an involved process that it augments such excellent care that we're providing from our physicians. So this department not only helps to identify care required, but also gaps. Part of that's called the critical care management gap, and there's programs in our software that identify that. So we're not just going to be attacking this from right now we have over 500 appointments that we're attacking that we've got to do by the end of the year. We have 4,000 plus patients in Medicare. 23,000 visits of each year are Medicare patients for Southern Plains, existing patients. If you think about that, that's 105 patient visits a day that are Medicare. So is this significant? On every level. It's significant for the patient, it's significant for Medicare, it's significant for our providers, And so I'm really excited about that. It's
Well, let's kind of shift over to current news and what's kind of, everybody's talking about the coronavirus. We've been talking about it, since, well, you and I have been talking about it since February, early February. So it's definitely top of mind. What have Southern Plains really been doing with the coronavirus over the last few months?
Hal, this is something that I am so proud of our team.
Yeah.
And what, as a company, that we've made a decision to do. Part of our year certainly started out, as usual, collecting deductible copays, seeing patients coming out of winter, and that really didn't get a good start. And then we had some pretty aggressive flu-like illnesses, but people were being knocked down for a week at a time, probably tracing back to maybe even October of last year. And you were ill, some others that we work with were ill. And so we began to take a look at this then soon to be branded COVID SARS virus. And because we operate a high complexity lab here in Chickasha for years servicing our 3 counties, we made a decision to invest capital into establishing a PCR metabolic testing system and department, really, which is separate from our high complexity lab department.
Everybody's been hearing the PCR because that's what is required for most places in the state of the government.
Gold standard.
Okay.
Absolutely gold standard. So what we did aggressively was get with, Corey, our lab director, is highly educated, highly capable. So Corey and I sat down with our senior partners and said, hey, we got to do this. So Corey and I put our heads together. We researched the thermal cyclers, the extractions, the supply chains, and early on we established ourselves as the leader in Oklahoma to do COVID-19 testing in-house in about 24 hours.
Wow.
So we have vacillated between 24 and 36 hours regardless of the volume. We have nearly 100 accounts, some of the largest nursing home corporations in the state of Oklahoma, from north to south, east and west. We have even local hospitals where we're doing discharges for COVID-19s or pre-surgery. If you recall, you couldn't have a surgery once they opened up again for non-essential surgeries.
Okay.
You still had to have a negative COVID-19 test within a period of time, 3, 5 days before you had the surgery, so you didn't take COVID into the hospital setting, surgical setting. So we've been doing drive. In fact, since we've started this interview, we've probably swabbed in our parking lot. Could be from a half a dozen to a dozen people come in. They can call in, they drive in, we swab it and go. Likely one of 45 nursing homes could have dropped off 50 or 100 tests to our lab while we've started this. Our own core patients in 3 counties probably swabbed and sent up. So, and you've been working with professional teams. We've worked with school systems now more aggressively as this opens up. Municipalities, we've tested a number of cities in Oklahoma. Why? Because when you can get a result that's 100% accurate inside of a day or day and a half, give me maybe a little longer over a weekend or whatnot, although we're working 7 days a week and now staffed up to do tests almost 24 hours a day, it feels like, for Corey, I'm sure.
Operation, but they sure have been running that
Not anymore.
24/7 for sure.
Yeah, well, I've been here in a couple of weekends with Corey and I know he doesn't sleep. So we've had great team effort on that. We believe that that's, back again, our core of servicing the needs of our population. We just stepped way outside of our population and said, our population of service is the state of Oklahoma. Anybody or any group that wants to send 50 or 100 COVID-19 swabs to us in FedEx overnight, we'll put them in queue. We'll get their results queued back, usually within 12 hours. That's not, that's if they're positive. Now, the nice thing about it is we've incorporated some most latest total antibody test, so they can do that as a precursor. In fact, I've got some data I know that you're going to be launching on the website that we just received about the need of using a precursor, and the specificity is up to 98%. That's not the golden standard.
Right.
But if you had a mass of people that, Amazon that wanted to test 1,500 people, run a finger prick antibody test, and you'll know who we need then to test for COVID-19. So we're privileged and geared up to work with school systems and municipalities and additional nursing homes, hospital systems, because we can get the result in not 5, 7, 10, 14 days, and some we can get it to them.
this morning.
But we're grateful to continue to serve Hal and our core values on our expansion of our facilities in 4 counties now. We're going to do it again next year. You don't know where we're going to find ourselves next year, but you're going to find ourselves next year. And we're going to continue to pour our time to invest in our patients, in serving our patients, and meeting needs that otherwise they just simply weren't. They wouldn't have gotten me, can't get. So appreciate the opportunity, and our team is just phenomenal. And we're growing stronger with stronger people every day.
Absolutely. Well, I had no idea we were going to end up in Edmond. I'm super happy about that. I've loved going up there and spending some time up there with them, as I love coming to Chickasha at Southern Plains Medical Center every day. Really cool. Len, thank you so much for taking some time out of your really, really busy life, as we just shared. If you guys have any questions of anything that we talked about, or if you've had any symptoms, or if you think you've been around anybody that's positive, give us a call, 405-224-8111, or go to our website, www.spmcmed.com. Southern Plains Medical Group, your hometown medical team in Oklahoma since 1915.
Done.